This is Tom Fox. I'd like to welcome you to a new offering from the Sunday Book Review, which is the Sunday Book Review Authors Edition, where I visit with an author over his or her book about compliance, leadership, and best practices. Numerous folks have asked me to put on a book review podcast, so the Sunday Book Review Authors Edition will fill that slot. Thanks for listening. Today, I visit with Jay Anstine, author of Navigating the Politics of Healthcare, a compliance officer's guide to communication, relationships, and gaining buy-in. First, a word from the Compliance Podcast Network sponsor this month, Ethico.
Handling multiple compliance cases can often feel like navigating a complex labyrinth. Ethico introduces simplicity and intelligence into this chaos with our custom workflow automation. By automatically routing cases based on your unique criteria, we turn the maze into a clear path forward. Envision a compliance process that's not just effective, but also intuitive and adaptable to your needs. It's time to redefine efficiency in your workplace. Embark on this journey of transformation at ethico.com/CPN. Book a demo and explore the white paper by Tom Fox, 2023, The Year in Compliance, to discover a world of seamless compliance management.
Hello, everyone. This is Tom Fox, back for another episode. And today, I'm absolutely thrilled to have with me Jay Anstine. Jay, first of all, welcome, and thank you so much for taking the time to visit with me today.
You bet. Thanks, Tom.
Jay, could you tell our audience a little bit about your professional background and what you're up to today?
Sure. So I've been in the healthcare industry since 1999. I originally worked for a managed care organization. And actually, before that, when I was in college, I was a political science major and did an internship with a judge and had wanted to go on to law school. But I knew at 22, I was just not quite ready for that, and I wanted to try some other things. And so I bounced around a little bit in there. I had fallen into healthcare, and then I found I really liked healthcare. And so then after about 5 years from college, it was just getting to be a monkey on my back a little bit. So I figured if we're going to do this, we better do it. So I did go back, and then I just decided to make the focus healthcare. And I think initially I thought I was just going to stick with healthcare law and practice. And I did go that route for a little while after school, but then eventually I got turned on to compliance, and it just seemed to be a better fit. And that's where I've been ever since 2005.
I don't think I've ever heard someone use the phrase turned on to compliance. Tell me how you got turned on to compliance.
Yeah, a couple things, and it was maybe a slow progression. But what had happened was when I was working in the legal department for a health system, we worked hand in hand with the compliance department there. And so I got a little bit of a taste of it from that experience. And then I ran into sort of the pivotal things that happened where my position got cut with the health system. I had a long-term relationship with a significant other that came to an end, and I was really at a point where if I was going to relocate, that was the time to do it. And I grew up in the upper Midwest, but I am a skier and a mountain person at heart. And so I had started looking at positions out in Denver, Colorado. And I was just finding a lot more compliance positions than legal positions. And so I thought, I'll do this for a year or two, get out to Denver, and then I'll go back. I'll take the bar out in Colorado, and I'll go that direction. But then as it turned out, after a year or so in compliance, I just really liked it. I liked the investigations. I liked the education component to it. It just felt like every day was a little bit different. And I had already spent 4 or 5 years doing a lot of transactional work and reading contracts and bond documents and things like that. And I just knew I didn't want to do that the rest of my life.
As both a recovering trial lawyer and a recovering general counsel, I completely get that.
Yeah.
So let me pivot to, I've never had the chance to ask, what is healthcare compliance?
Sure. Typically what I will tell people that are not necessarily have any background in the work that I do is I work on the business side of healthcare is what I usually tell people. And so specifically the crux of it at the central point is Medicare and Medicaid and these other federal healthcare programs being taxpayer funded. And there's a lot of concern within the government to make sure that the money is being spent appropriately and individuals aren't engaging in fraud, waste, and abuse or not complying with the regulations. And so the center point of it is Medicare and Medicaid and those organizations that participate in Medicare and Medicaid, such as hospitals or physician practices. And there's all kinds of rules that they have to comply with when it comes to billing and billing out a particular procedure. There's certain quality metrics they have to meet. Services in a hospital setting, for example, services provided in an emergency department. There's some rules and regulations around that. HIPAA would be another one that probably most people are familiar with when it comes to their health information and guarding that from a privacy and security standpoint.
Now you made me even more concerned to ask the following question, which is, what are some of the top challenges? But given the list of multiple issues in compliance, I see multiple top issues in healthcare compliance. So what's your take on that?
Yeah, I would say certainly number one would be billing and coding, making sure that services that are being billed out are done so appropriately. And oftentimes it's not intentional that somebody is intentionally trying to use a different procedure code in order to get more money. It's the billing systems or the software, there's glitches or there's updates, or it's human error. For whatever reason, there's a spectrum of potential behavior, but a lot of times it's on the accidental side. And then the way the regulations are written now, once you've identified that you've billed Medicare out inappropriately, for example, you're duty bound then to do an investigation and report and return that money. Otherwise, it's considered a reverse false claim in healthcare, and there's all kinds of fines and penalties that attach to it.
So you have an affirmative obligation to self-disclose?
You do now, yeah. Before that came about back in 2009. In the industry, we call it a reverse false claim. But essentially, it's if once you become aware that you had money you weren't entitled to have or you weren't supposed to have, then you have an obligation to report and return that. And there's some timelines around it. They do give you some time, a few months, to do an investigation to quantify the amount that you have to return. And then they give you 60 days to, once you've quantified it, to report it and return it.
How thorough, I don't want to say thorough in your investigation, but how far back do you have to look to see if you've had problems before or after the point in time you discover it?
Yeah, that's a great question. So going back in time, what we would call a look back period, would go 6 years back from the date that you had identified the error. That's the furthest back in time it goes. Now, oftentimes what happens is once you're doing an investigation, of course, facts and circumstances can vary from one to the next. So you might have a situation where maybe the organization changed billing software and they only did that last year. So you might say, okay, let's go back at least a year when we know this change happened to see if that's the furthest point it goes back, or do we need to go back further? That's always a question you have to ask as you're doing these investigations.
Almost all industries now have some type of whistleblower program, some type of mandatory hotline or anonymous tip line, but in healthcare, you have false claims acts. And how does that dynamic change, if any, the issues around reporting or not self-disclosure, but internal reporting or internal whistleblowing?
Mm-hmm. Yeah, it's definitely a component to it, and the organizations are required to have policies and procedures in place around that, and they have to do education around it. There are some state law versions of the False Claims Act. Most states have now on the books, and they typically do audits around that to make sure that you've got policies and procedures in place to protect whistleblowers and you are doing education. In terms of the impact on the industry, it does give another potential outlet to protect somebody to come forward and encourage them to report something that they think in good faith may be going on that's inappropriate from a billing perspective.
You almost answered this question earlier, and if you didn't answer it, you alluded to it, but you've also got a current teaching career as part of your portfolio, and you've had that for some time. What led you in either back to or into academia in the compliance realm, and how have you found that experience?
Yeah, so I have been teaching with the University of Southern California's law school. It's a healthcare compliance specific course, and which we cover compliance programs, the 7 elements, CIAs, and then some of the major laws that, again, I would say impact the business side of the healthcare industry. And that started really back in college. I should say, you can go back further a little bit. Growing up in grade school and whatnot, in high school, I was not a stellar student. I got through school just because I got through it, but didn't really have a love for it. But when I went to college, I really loved education. I loved the courses I was taking. And then the same thing when I went back to law school. I was probably one of the few people in my class that actually enjoyed the experience. I would not want to go back and do it again, but I thoroughly enjoyed the experience. Had a great relationship with my professors, and I think I was really enamored with that back in school that I felt like I want to do something with teaching in some form or fashion. I think that's another reason it drew me into compliance, because there was an opportunity to do a lot of education and training with employees that really prepared me for having a career as an instructor in an academic setting.
You mentioned the term CIA. Could I ask you to define what that is in the healthcare compliance space, and then maybe compare or contrast it with deferred prosecution agreements that we see in other industries?
Sure. Yeah. And a lot of times I'll tell people it's not the Central Intelligence Agency. So it's a corporate integrity agreement. And typically these are an agreement that an organization that participates in Medicare or Medicaid would enter into with the federal government to avoid the full force of fines and penalties. And I always tell employees, or if I'm doing some type of training, think of it like terms and conditions and being on probation. I've thankfully never been on probation, but my wife used to be a probation officer. And so I always think of it as, once you enter into one of these agreements, you get assigned a monitor from the Office of Inspector General. It essentially acts similar to your probation officer. And then you have a set term. I think most often they're 5 years. And then there's lots of obligations with those that you've got to comply with throughout that 5-year period. A lot of reporting obligations and potential self-reporting obligations and things like that.
So I have not reviewed a very large number of CIAs, but I've read a fair number of them, generally when there are allegations of bribery and corruption. But the thing that strikes me about CIAs and how they contrast with DPAs is they're much more detailed. And the obligations, wherein a DPA would be set out somewhat generally, in a CIA, they really drive and delve into the weeds, sometimes seeing like the number of persons who have to be on a compliance committee or other details. Is that consistent with your experience with CIAs?
It is, yeah. And often, if not always, when organizations enter, at least in the healthcare space, when they enter into these agreements, there's some type of deficiency within the compliance program that the CIA is there to try and bolster or make more robust. Now, that could vary from the organization didn't have a CIA at all or didn't have a compliance program at all, to they had a compliance program, but it really wasn't robust enough, or they needed more resources attached to it. And so, to your point, I have seen CIAs set up where they did designate a specific number of compliance officers, for example, that had to be hired for an organization.
The DPA is, although obviously a government generated document, it's also the process, or the product rather, of negotiation. Is the same true with a CIA? And can someone like yourself representing a healthcare provider literally sit down across from the OIG or whoever the appropriate governmental agency is, work through some of the requirements and agree to them?
Yes, and there are some terms typically within the CIA that are a little vague and need to be spelled out as between the parties. For example, typically with the CIA, there's going to be a self-reporting obligation where if you identify something happened, I'm trying to think of an example here in just a sec, you'd have to report that into your OIG monitor. So let's say, for example, you had billing, we were talking about billing earlier, maybe you had found out that the organization was billing out the wrong CPT code, and that was to the tune of $150,000 or something like that. Typically within the CIA, there's going to be a provision in there that talks about a self-reporting obligation. They could typically call these reportable events. And they might define those in there as something like the organization goes through bankruptcy, there's been an individual that's been hired or retained that's an excluded individual from participating in a federal healthcare program. Another one would be a substantial overpayment, but they don't really define what substantial is. So you have to work through the definition of what that actually means. Is that something over $100,000? Is that something a little bit less? And part of that intentional vagueness is because you're going to have CIAs, you potentially with a very small organization, or you might have one with a very large health system that has a significant number of resources. So it depends on the organization that's under the CIA.
So let me turn to your book. I found it very interesting. You were kind enough to provide to me a reader's copy. Let's just start off with the title, because
Sure.
I found that as interesting really as anything else, which is navigating the politics of healthcare. Before I even ask you what led you to write it, why and how did you come up with that title?
Sure. I writing a book had been something that had been on my bucket list for a number of years, and I'd never really could land on a topic or what I would actually write about. I knew it probably would be in the nonfiction business space. For a number of years within the Healthcare Compliance Association, they have a compliance institute similar to the annual conference that the SCCE does. And I had spoken at this conference for a number of years on what I would probably call soft skills type topics, how to be professional in your communication. I did one actually called Navigating the Politics of Healthcare, how to build better relationships with those in operations. And I just found those topics I really liked speaking about them because it was almost conversational, as if I was having a conversation with somebody at a restaurant. And I think part of what led me to that thought process too was some of the things that ended up in the book really came out of conversations I was having with colleagues at conferences after the conferences were over and we were having dinner or drinks or something like that. So I felt like that was something that was easy to talk about for me. It would be something that would be of interest. And I wasn't finding a lot of, the time I started writing the book, I didn't find a lot of books out there about navigating the soft skills side of healthcare. And that was what in my experience, I found was really one of the most challenging things about the job in terms of being a compliance officer in healthcare was, and probably other industries too, but this is just what I know. You've got a lot of different types of personalities that you have to interact with, a lot of interested parties. And some of the success of the compliance program really depends upon managing and navigating those relationships and trying to get people bought into the compliance program, getting leaders to report things proactively instead of reactively. And I think in the context of healthcare, it may be this way with other industries, I'm not sure, but I know within healthcare, there's a lot of politics. And what I would say with that is not politics where it's argued as a right or a privilege, but rather probably the business or office politics of healthcare. You've got a lot of relationships between physicians and CEOs of hospitals or other leadership positions that can get tense. There's a lot of competition amongst physicians, and these politics you have to factor in as you're doing your work. Not to say you don't want to let them guide you what your ultimate decision is if you're doing an investigation, but they are things to be aware of. If you're conducting an investigation, you might want to know the background on the two parties that you're talking to or what their relationship might be.
So the compliance professional, now that I have a better understanding of the language of the title, how should a compliance professional either think through or maybe even prepare for navigating compliance in the healthcare space?
Yeah, so one of the big things that I advocate for in the book is really knowing what I call your political landscape, or just those around you and their relationships with CEOs and members of their C-suite, or in the context of healthcare, CEOs and physicians or other clinicians, relationships between physician groups and other physician groups, who gets along with who's a little testy with who, are there tense relationships between some folks, are there closely guarded alignments, and just be mindful of those things always as you're doing your work, because it can help in terms of how much weight you might give or credibility you might give to a particular individual if you're working through an investigation, for example. But also with knowing the political landscape is knowing who has formal power in the organization, who has informal power in the organization. It's not always that it's the CEO. It might be the admin assistant to the CEO, or it could be maybe a member of the C-suite that reports up to the CEO, and that CEO leans on that particular member of the C-suite pretty heavily in making business decisions. Knowing who has formal and informal power, that can help, I think, from a compliance perspective, because if they are coming to you seeking guidance, they want to do a proposed deal with another business partner within healthcare, and you're trying to outline what they can and can't do, it can help to know those relationships, because you know who you can go to for support or potential leverage if you need to get something where, because ultimately your goal is to make sure that the business agenda of the organization and the compliance agenda are in alignment, because those two sometimes can conflict if operations is wanting to do one thing and the compliance department's wanting to do another.
Let me go into the weeds a little bit and ask about compliance training. And in the non-healthcare space, the Department of Justice talks about targeted and effective training. I don't know if healthcare requires targeted, but I know they require effective.
Yes.
How do you help a client think through demonstrating the effectiveness of compliance training?
Yeah, I think, and we do have targeted in some, we have typically general healthcare compliance related training, and which includes fraud, waste, and abuse training. But then there is specific and targeted education and training that needs to be done with individuals in certain positions, billing and coding being one, because the codes and the billing rules are always changing. People have to be on top of those changes. There is specific targeted education that you have to complete, or the individuals have to complete throughout the course of the year. In terms of the effectiveness, I think making sure that it's being delivered in a format that you can appeal to a wider audience. Obviously, you've got an adult learner population that you have to account for, and some people are visual learners and some people are auditory learners, and making sure that you're covering different mediums to make sure that the training is effective. And I think from a measurement standpoint, there's different variables you can look at in terms of how engaged your employees are. Are you seeing an increase in reporting through the hotline? Are you seeing an increase in reporting on a proactive basis versus a reactive basis from your leaders? And sensing whether or not the culture has changed within the organization to have a more healthy culture of compliance. And sometimes you see this with some of the business decisions that are made by leaders.
So I had a friend who advocated the following. If I had to have a meeting with a senior business leader, I brought food. Like if it was in the morning, it was donuts. If it was in the afternoon, it was pizza. If it was later in the day, he might suggest a libation.
Yeah.
Do those types of strategies help in healthcare compliance, or how would you maybe counsel an up-and-coming healthcare compliance professional on building relationships with other healthcare leaders?
Yeah, those are tactics that do work, or snacks or something. I always typically advocate for making sure you're taking two things. One is you're taking into account the audience's perspective, and that can mean making sure that the environment is comfortable. You're not setting up a training that's going to be 2.5 hours long or 3 hours long straight, that's operating like a lecture. Maybe breaking that information up into bite-sized pieces, or making sure breaks are built in. So a lot of times what we run into healthcare too with frontline staff is you might have folks that are answering the phones, or they're covering the front desk, or they're caring for patients, and they typically have a tight schedule. And so making sure there's coverage for those positions so that those people can rotate in and out through the training, and offering multiple training sessions is another way. But yeah, anything you can do to make the environment more comfortable for them, I think does help. If you're doing maybe a specific targeted training with a smaller group of individuals, and you can find out what they might actually like, whether that's a particular snack or drink or something like that, I think that always helps. But anything you can do to take the audience's perspective into account.
And you also have a chapter on the boundaries in healthcare compliance. And frankly, I have never heard a compliance professional talk about boundaries in compliance. So please tell us what you meant, and is it unique to healthcare compliance?
Honestly, I don't think, looking back now, I don't think it's unique to healthcare compliance. I just only wrote about what I know, which is our environment. But yeah, boundaries within healthcare compliance operate much like your personal boundaries, what you might find acceptable and not acceptable. The use of offensive language or not, those are just a quick example. The use of someone else's time often is another boundary, making sure you're not wasting other people's time. Or your method of communication. If some people prefer email, some people prefer phone calls. These are all just different examples of the types of boundaries I think that do exist in really any type of industry. Specific to healthcare compliance, we do have a couple that we typically have to navigate, and I included them in the book. As a lot of times with us, we have a couple other departments within the organization that are very close to us, but they do something a little bit different. But to a CEO or somebody in operations, they all just think of us as compliance. So one would be risk management. So typically, if a patient or a family member of a patient is going to make a complaint that the care was deficient, or there was a bad outcome, there might be potential malpractice suit or litigation or something like that. Those types of complaints get handled through typically a partnership between the legal department and then a risk management department. And risk management typically is made up of nurses and clinicians, those that would have a clinical background. Unlike some compliance officers are RNs by background training, but typically you want somebody that's got that clinical background in those roles to be able to evaluate and assess those types of situations to determine whether or not the standard care was met or not. So risk management's another department. Some organizations splinter privacy off to a completely different department, while others have it under the compliance department. Then you've got the legal department. Typically in healthcare, will oversee anything from a legal risk standpoint to the organization, also overseeing contracts and operational agreements and assessing things from a legal standpoint. And then you'll have another department, sometimes in larger healthcare organizations, it's called regulatory, where they're monitoring scope of practice and licensure type questions and changes in state law. And they're a little bit more closely connected to the clinical folks. And so what happens from a boundary perspective is somebody comes to the compliance officer asking a legal question. This is probably the classic example. Did we violate this law? Is this illegal? Those are common questions that come up. And those are situations where, because of the scope of the compliance officer in the organization, it's not appropriate for them to handle those types of questions. Those need to be referred to legal counsel, whether that's inside counsel or outside counsel. And so the boundary here is just making sure you're not crossing over that and giving out illegal advice, which I know has been a big discussion lately within the newest guidance, compliance program guidance document. But again, making sure you got a good relationship with your legal, you appropriately redirect those over to the legal department and have them handle and address those particular questions or concerns. Another one would be if somebody comes in with a patient complaint that really deals with the appropriateness of care that was provided to that patient. That would be something typically outside the scope of the compliance officer to address. And so those need to be handled by risk management.
I'd now ask you to maybe turn your head to the left or right and look down the road a little bit to, dare I say, mid-century, 2030. And where do you see healthcare compliance headed down the road?
I think continually going forward or up. Since I've been in this particular industry, it's been, I think, like compliance positions in other industries, very much a growth industry. The regulations aren't going anywhere. If anything, they're going to be even more out there. And so I've always said that's job security, which is partly why I got into this line of work too. I do think we're going to see, because there's been changes within the last decade related to making sure that payment or reimbursement that the providers are receiving is connected to quality of care. I think that's going to continue to be an emphasis and a focus. Transparency is another one within the last 5 to 7 years has been big, as the federal government and the state governments have imposed new requirements to make sure that healthcare organizations are more transparent about the prices that they're charging, because it is a unique industry where you have largely payers that are footing the bill for services being provided to patients, and potentially there can be some abuses there. It's not an easy discussion, but that's one I know that's been currently playing out within the last 5 to 7 years. I see that probably continuing as we try to get to a goal of having more transparency within the industry for what types of prices patients are being charged.
Jay, unfortunately, we are near the end of our time for this episode, but before we leave, I wanted to ask you if our listeners wanted any more information on yourself, your book, what might be the best place or places for them to go?
Sure. So I'm on LinkedIn. You can find me there. I do post pretty routinely on LinkedIn. My website is .com. You can check me out there. And the book is available on my website, and it's also available on Amazon and Barnes & Noble and any other major retailer as well.
Jay, I greatly enjoyed today's episode. I thank you again for taking the time to visit with me, and I hope we can continue this conversation.
That sounds great. Thank you, Tom.
As I mentioned at the start of this episode, this month's sponsor for the Compliance Podcast Network is Ethico. Are you wrestling with your case management system, not getting the support you need? Get what you deserve from your software. Ethico is offering up to 1 year free on any new service. That means new case management, innovative issue intake, and enterprise-wide disclosures, and much more. To learn more, go to ethico.com/CPN. I hope you will check out Jay's book, whether you're in healthcare compliance or another type of compliance. Although the word politics is in the title, it's really about the soft skills every compliance professional needs to navigate the corporate world, both up the organization to the board of directors, through your peers, and then down through the organization. I know you'll enjoy the book, and I heartily endorse it.